Namaste. Today we are going to learn what is going to happen or what is happening in autism spectrum disorders. So, for that, we need to know there are three qualities of mind or three functions of mind, we can say. That is what Ayurveda says, that the first one is dhi, second one is dhriti, third one is smriti. So, it is nothing but dhi is nothing but intellect. It's what our intellectual capacity says. That is what dhi. Second one is dhriti. Third one is smriti. Smriti is nothing but memory. Everybody knows that what is intellect and what is memory. In between these two, there comes the dhriti concept. Dhriti is nothing but the coordination, we can say. Means it's the ability of a person or a kid to know where this intellect as well as where this memory should place. This is what lagging in autism spectrum disorders. So literally they are not behind intellect, because I am seeing n number of cases since many years. There is nothing happened to intellect. There is nothing happening to memory. You might also be noticing this memory is very well in autism spectrum disorders, but they don't know where this memory and intellect should be used. So as a treatment point, we have to work on this dhriti concept, not in intellect. How we can know that? In therapy centers and almost all the trainings that we are giving, we are working on this intellect or academics. Maybe, for example, we will be using or we will be giving training to improve the vocabulary, because last month he was knowing only 5 words, this month he knows 10 words. This is what the progress report says. Parent will be happy, the therapy centers will be happy. But as per my point of approach, we need to know whether that 5 words that he has studied or she has studied, he is able to place it in appropriate place. Then only it will be useful. Otherwise, you can teach them 100 words, 1000 words, 5000 words. How much you can teach him, you can teach. But if they don't know where it should be placed, what is the use of that? And if you are trying to increase the memory power, you might be giving 10 numbers to learn. Tomorrow they will be repeating that, or they will say it back also. But if they don't know where that should be placed properly, what is the use of that? So ultimately, in autism spectrum disorders, we have to work on this dhriti concept or the coordination concept or common sense. What should be acted at what point, how much it should be acted. This is what we should work, not on intellect. And the other point is, if the kid is well versed in this dhriti concept, automatically intellect as well as memory will work. But if you are working in intellect concept or the concept, it is not sure that his dhriti will come up. If you are working on smriti concept, smriti will come up, but dhriti may not. But the thing is, if you are working on dhriti, both dhi and smriti will be getting better. So just keep this concept in mind. We don't want to go deeply into increasing his intellectual capacity or the memory power. It's nothing but where it should be used. So thank you. Namaste.